Ready for me?
Yeah, I don't fit, so pick it up.
There you go. Like that? How's that?
Yeah.
Okay, better?
Not quite hanging off the table. I took him a month to prescribe me the stocking, and it took him a month to prescribe the PT.
I wonder why they didn't have fast enough.
I don't know, but I want him to be in the loop as well.
His schedule, and he's just going to see him for a minute. Do you have a filter?
That's how?
Did they put a filter in you?
No, not yet.
Okay.
I haven't done anything like that, so.
Yeah, so it's our Facebook page is just called Total Vascular Wellness, exactly like our
Okay.
company.
All right, cool.
Let's see this is on it.
Here, Dr. Siddiqui will be right with you.
Thank you.
Can I see what Brenda was originally now?
Mr. Brown.
Hey, how are you doing?
Linda asked me to come and talk to you.
Yes,
And you're so gentle, nice speaking. What's your secret?
I used to stutter when I was younger,
Uh-huh.
and I overcame that. My parents put me to a speech therapist.
But
So-
you speak so nicely and so soft.
Oh, I do?
You could be our next president of USA.
Oh, no.
Do you listen to him?
Yeah.
Somebody told me that he used to stutter too, Joe Biden.
Oh, yeah,
Did you know
he did?
that?
I didn't know that. No.
Yeah, somebody told me. And there was another fellow who said he used to stutter, but he overcome. The one, Geraldo, with a big mustache.
Geraldo Rivera?
Yeah, he
Oh,
used to
okay,
be
yeah.
on ABC on 2020,
Yeah.
and then he switched to some other company. So let's take a look at your leg. You want to stand over here for a second? Today somebody is taking one room, and so we are running
Oh, okay.
behind. Look like the swelling is going down.
Yes, the
And
sock.
you don't have the boot.
Yeah, the sock did an amazing job on the sock.
Yeah.
But if I take the sock off and wash it, then
Yeah.
it swells up just a little bit.
Yeah.
But I can, push down and then it leaves an indent still.
Yeah.
So
Do it ankle and
yeah,
this one.
that's PT has helped with that.
Yeah. And
So-
you're off the boot and you got your own boots.
Yes.
Yeah. Yeah. Have a seat.
Okay, thank you.
Yeah, this Miss Becca, she's a promising PA student.
Awesome.
Okay, let me take this call. I'll be right back.
Okay.
I'll be right back.
So what happened?
So I guess I was in the wrong place at the wrong time. Somebody ran over my foot with a cart. Or he was in the wrong place at the wrong time.
Those dollies?
Yeah.
Oh, man.
And boxes on Amazon. And it just crushed, I guess, top of my foot.
Okay.
So when I went because I worked the graveyard shift,
Okay.
so I had to wait until the next day in the morning to be able to go to the doctor, their doctor.
Okay, wow. Their doctor.
Yeah, their doctor.
Okay.
I can't go to mine, I had to go to theirs, so which is fine. And then they took x-rays, and she said, well, this swelling was so bad, she couldn't really tell if it was fractured or not. It wasn't broken, but they couldn't tell it was fractured.
Okay.
So they put me in a boot and crutches.
Oh, when was this?
This is in December.
In December.
Yeah.
Okay.
And then I was off for a week, and then they said, go ahead and go to light duty. So I sat in a chair for 10 hours a day,
Oh, okay.
right? In like little hard plastic chairs.
Yeah.
And then that's when I noticed the swelling went up to my calf.
Uh-huh.
My calf started hurting.
Okay.
Like I asked them, I said, that's part of it. Don't worry about it. Just keep your foot elevated and go with it. And on the 28th, I said, something's not right.
Right.
And that's when they sent me to the ER and found out that I had
DVT.
the DVTs. And then the PE.
You had a PE too?
Yeah, I had PET, but I didn't know. So no one told me to watch out for shortness of breath.
Okay.
So, since we work at Amazon, I thought I had COVID. Because I had the shortness of breath. And one day I was like, oh, it hurts so bad. I don't know. Maybe I'm getting sick. So I didn't put two together. I didn't know what to look out for. So
they told you at the ER that you had a DVT.
And at the ER, they found out I had a DVT and I had the PE.
Oh, wow. So you'd had both and you had no clue.
I had no clue.
Oh, you're lucky.
I know.
Okay.
I didn't know. I mean, I would just, my wife, there's my wife there. She came home one day. We both work at Amazon.
Okay.
And then I laid in bed. I was crying and it hurt so bad. And she got mad at me because I laid in bed all day. She goes, well, you didn't do anything. You just laid in bed. And I told her, I said, yeah, I hurt.
Yeah.
And that was the day I was having the PE.
Okay. Wow.
Yeah. And then now I'm on, on that email. I was flustered because I was running out of blood thinners.
Oh, okay.
I sent an email to my team, my Amazon team. I said, look, guys, I'm going to admit myself to the ER if you guys want to figure this out. It took them a month to prescribe. I finally got this, my sock.
Oh, okay. This is the Amazon team?
Yeah.
Okay.
So I saw him on the 121.
Okay.
Right? He issued the compression stocking and wanted me to continue with the light PT and move forward because he said exercise is good. I didn't get my stocking until a month later.
Oh, wow.
And then I started PT a month later.
Oh, okay.
And then when I was going through PT, at least the Baylor Scott and White, they're more aware of my condition, whereas the Concentra doctors, their PT, they wanted me to do squats as soon as I left the ER.
Oh, wow, okay.
I said, no, this is not right. But I'm trying 100% to get my balance back, my muscle back on my leg.
Okay, right.
And I was doing some leg presses and stuff, and the day afterwards, and that's when I noticed I was shortness of breath.
Shortness of breath, okay.
I didn't know. I figured I had to wait a little bit to see if it gets worse. And then your ultrasound tech said if you have shortness of breath, just call 911.
Yeah.
Don't take that chance. I didn't know.
Right.
So, but no, that's because of the, we kind of overdid the PT a little bit, maybe. I don't know. I don't know what to. I don't know what to expect. I don't know what to do.
Yeah.
I'm just kind of hopping around, I guess.
So you work at Amazon warehouse?
Yeah, the fulfillment is there. I'm working on the robotic side.
What is the robotic side?
So the robotic side is, we process the boxes that the vendors send.
Okay.
So we open the boxes up and just throw them. We feed a robotic, and the robotic sorts it.
Oh, okay.
Yeah.
Okay.
So we do like 1,000 items an hour. It's crazy.
The improvement in the leg is impressive. He was in boot when I saw him. He was missing.
Very
And,
unhappy.
Good news is Linda said, she showed me the picture. She said there's a little trickle of the flow.
That's what she
They
said.
look like they're trying to open up. So my request will be to keep using the anticoagulation and compression stock when you're up and around. And you can get, as the swelling go down, it gets loose, then you get a new one.
Okay.
Because the loose one doesn't do the job.
Okay.
And then when it's to the normal side like the other one, your long-term friend will be starting on both sides, the compression.
Okay.
When you're working, when you're walking, that becomes part of your, dress up
routine.
uniform. Because it's good for, this leg had a DVT, that one doesn't, but it just gives you a nice flow push to the calf.
Okay.
So that's one. This was your first injury and episode of a DVT and blood clot go to your lung. So everybody would say at least continuation of the blood thinners for 6 months at least.
All right.
And then you can revisit and say, should I go another 6 months or should I stop?
How would we know that? We just do another ultrasound to see where the
This
clots
is
are
your
progressed.
injury was in December, and I remember then you went a couple of times clinic, and third time they found the ultrasound
Right.
That was in January.
Right.
And I put you into MCA. So this is your 3 months.
Yes, sir.
So I think we check it 3 months later, and that'll make it 6 months, and then we say, is the recanalization happened, but they decide about blood thinner.
Okay.
Yeah. Are you taking Xarelto?
Equalist.
Yeah, Eliquis.
Yeah.
Eliquis I like.
Yeah.
Yeah.
I'm still taking 10 milligrams a day.
Yeah.
Yeah, okay. I was
More
telling.
questions for me. Linda just wanted me to tell you that there is some channels opening up, and I had seen you first time, and the more time go away from the time when it happened, the more it becomes scar tissue rather than clot.
Oh, okay. So
So
the longer we wait, the more it just becomes scar.
it becomes organized. It's become, I use the word fibrotic,
Uh-huh.
and some people do not recanalize. It stays blocked.
Okay.
Some people open up.
All right.
And I tell people I don't have a marker where you say who will open up and who will not. So activity is good, compression is good, anticoagulation is good.
Okay. Yeah. So
Yeah.
I learned a lot today. Yeah. So I'll continue PT, and then if I feel shortness of breath, just go ahead and call 911, right?
Beg your pardon?
I said I'll continue PT, and then if I feel shortness of breath, go ahead and call 911 just to be on the safe side,
Yeah,
right?
that's right.
Like I didn't know, like last week I had shortness of breath again,
Yes.
but it only lasted 10 minutes, so I didn't know
Yeah.
if that's something.
How old are you?
I am 48.
Are you a smoker?
No, sir. I don't smoke or
Diabetic?
drink.
Diabetic?
No, sir.
No. My thinking will be get the heart checked out.
Okay.
With the PCP, also go have refer to a cardiologist.
Okay.
Get a heart echocardiogram.
Okay.
Just to be sure heart function is good.
Yeah, but I had one of those at the ER.
Echocardiogram.
Yeah, they did an echo on my heart. Yeah.
Yeah, but now you're getting short of breath now.
Right. I got it last week, shortness
Yeah,
of breath, so I
so
didn't
I
know.
think it'll be, want to see if anything new happens.
Okay. All right.
Yeah,
Okay. I didn't know that could be related to the clots at all.
it could be, but clots usually start dissolving. Same like the blood clot in the leg.
Right.
The lungs, I can show you the scans of people who had a clot, and
So when,
3 months later, 6 months later, you do the lung, there's absolutely no sign
okay.
of any kind of it. So resolution happens, so lung can deal with it.
Okay.
But you would need be sure that your heart is checked, and of course you're right, if you're short of breath, you get another angiogram. That's the only way to know
Right.
if you have new clot or not.
Okay.
But the less chance is as the time go away from the clot.
Okay. So only if there's new clots, then I have to worry about the PE. Then,
Yeah.
Right? Okay. Okay.
Yeah,
I didn't know if, me working, doing the physical therapy is helping my muscle gain and everything else, and also helping loosen the clot. But that doesn't work like that, does it? I mean, there's obviously there's the clots. Now I'm having movement, so it's clearing up a little bit, right?
it's.
And the
I
pieces.
think you're trying to figure out without knowing with the anatomy and physiology.
Yeah, I don't know.
You're trying to figure out. Yeah.
Right. Yeah. Okay.
Yeah. Yeah, you can make your own conception. You can,
I feel like I'm going into a dark room. I don't know.
yeah.
I'm just feeling my way out because I don't know what to expect or what to do. I don't know what's
This
right
is
and what's wrong.
It's not, it's a very good intelligent person can get the concept, but actually I've seen it unless you really know anatomy and physiology and what goes wrong, what goes right, and they give you 4 years of medical school, which includes medicine, when to use it, what goes right for 1 year, all the learn anatomy, physiology. Then you say, well, okay, this is how it works right. When it goes wrong, why does it go wrong? Then you try to figure out how do you get it back to that.
Right.
Yeah. So I was explaining to Ms. Pkwy because she's learning, and I told Linda the clot gets stuck, and at day 0 you had a clot, And if you lived because of one of the fresh clot broke loose and went to lung, what is left there is getting more organized. Unless you get a fresh clot, that will go to your lung. The one which already happened is getting jammed.
Okay,
Yeah,
makes sense.
yeah,
Room 2, Dr. Siddiqui, they're needing to go here in a little bit.
yeah.
Your new patient in room 2.
Thank you.
Yeah, I know you're busy. I
Yeah,
appreciate
Linda
you
asked you to, stay and talk to me.
Right, I appreciate your time. I really do.
Yeah, I'm glad you're better. And there may be a lot of things, instead of once bitten, twice shy, you gotta worry about shortness breath. So you're right, you get it taken care of with the angiogram, get the heart checked,
Okay,
so not take a chance.
okay, all right.
Yeah, if you get short of breath, the 3 other things can happen also, like chest pain with pulmonary angiogram and embolus going, or you cough up blood. Those 2 things happen also.
Okay,
But if you're just short of breath, then you're getting conditioned with exercise.
right.
Yeah.
And maybe
I
that's
don't know
what it
whether
was.
you did it before
Right,
or not.
yeah, because I
But
was
don't
work-
assume it, get it checked.
Okay, awesome. Thank you so much.
Okay. Next time I'll ask you, tell me how did you overcome the stuttering. But I don't want to check time today.
Okay,
Yeah. How did you overcome? Let me know.
okay,
And remember that.
okay.
Can you wait just a little bit? We'll set up that appointment for you right now, and we'll have you go back there. Give me a second.
One down.
We'll go home.
You're right. How's it going? Good, good.